Our next presenter is a lifelong champion who challenges stereotypes surrounding diverse abilities and identities. She brings personal experience with the foster care system, domestic violence, and mental health and traumatic brain injury to her advocacy. Please welcome Amelia Edwards, Coordinator for Disability Partnership.
Good morning, everybody. Thank you so much for having me today. And of course, congratulations to Simon, the recipient of the Clarendon Robichaud Lifetime Achievement Award. That's an incredible honor, Simon. And I know that you inspire so many of us in this room. I know some faces here today, but not all. So I'm going to introduce myself again. My name is Amelia Edwards. I am a queer white woman in my late 30s. You probably can't see it from here, but I have lots of tattoos and the remnants of some emo kid facial piercings from my youth. Today, I'm wearing my black glasses. I have a throwback to that emo kid youth with some bright red plaid pants. And unless I tell you this, you might not know that I also live with a traumatic brain injury. I live every day with symptoms of that traumatic brain injury. Symptoms of fatigue, vertigo, chronic pain, sensory sensitivities, cognitive processing difficulties. And you wouldn't know that because it's invisible for the most part, right? Just like ADHD. I also am an ADHD girly. But you wouldn't know that unless I told you. So I'm here today as the culmination of all of these identities. I'm here today as the coordinator of the Disability Partnership and as somebody who believes so deeply in the transformative power of sharing lived experiences. So I'm going to tell you a little bit about myself. My advocacy journey started in my teens. I was a Crown Ward growing up in Ontario, and I was part of a cohort that successfully pushed for legislative amendments that extended the age of exit for youth in care from 18 to 25. That experience taught me how sharing my story, our stories, can shift narratives, change policies, and make real impacts. And then later, I went to university, much to the surprise of myself. I studied women's and gender studies at Carleton, and I focused on critical race, disability, and sexuality studies. And in those courses, I had the real historical examples of how sharing lived experiences has challenged stereotypes and redefined possibilities. And I carry those lessons in all the work that I do. Standing here today, too, I want to recognize my privilege. And I want to say that I'm committed to using it to advocate, to be an ally, and to learn. It's an honor to stand here authentically in shared vulnerability and connect with all of you. And I'm inspired. Every person who came before me spoke about vulnerability today. And speaking of which, I want to honor as well the decades of deeply vulnerable work by disability justice advocates in Nova Scotia. Some are here today, some are unable to be, some are watching virtually, and some are no longer with us. The Disability Partnership would not exist without your determination and your connections, and I celebrate that legacy. And really, that's why we're here today, right? So we're here to celebrate, right? Yeah? Yeah. That's why we're here. We're here to connect, right? Yeah. That's why I'm up here completely out of my comfort zone, talking to a room full of people I don't know with a microphone, right? We're here to network. We're here to celebrate. So I'm going to invite you to connect, not just with me, but with the incredible people in the disability community who are the real experts behind the work that I do. I truly believe that when I show up as my full authentic self, tattoos and old piercings and all, it creates space for others to do the same. It creates safe space for others to do the same. And vulnerability can be challenging, but that's where the magic happens. That's how we relate to each other. That's how we build trust, how we connect, and ultimately how we create that change that we want to see in our world, in our province. So I'm going to tell you a bit about the partnership. The Disability Partnership is, at its heart, a network that was envisioned by those dedicated advocates who did the foundational work long before I came onto the scene. And most recently, in 2019, several key partners held a series of community engagement sessions where folks, contributors, organizations, people with lived experience emphasized the guiding principle of nothing about us without us. A strategic plan was developed at that time, and several startup activities were prioritized, establishing the backbone organization with the dedicated staff, that's me. Developing the recognizable brand, social media, website, all of that presence. Creating the sustainability plan, which is less my favorite part, but integral to the work that we do. And ensuring that our members have opportunities, ample opportunities, to influence both the public and the private sector agendas. The work of the steering committee was well underway until 2020, when, as we know, the global COVID-19 pandemic put many priorities on hold as the community shifted focus. And despite the challenges of physical separation, we found creative and innovative ways to stay connected and to care for our most vulnerable Nova Scotians. In 2023, with the support of key partners like Easter Seals Nova Scotia, Autism Nova Scotia, NS Leo, and the Accessibility Directorate, commitment to the Disability Partnership was renewed, the 2019 priorities were refined, and the project was launched. Members agreed on a common agenda and narrowed the priorities into four key areas that will drive systemic change and enhance the quality of life for persons with disabilities. You can see them here: communication, education and training, capacity building, informing policy. And after more community engagement sessions with these core disability service organizations, members joined one another in person at quarterly meetings twice this year, one in HRM and one in Colchester County, and both meetings were incredibly well attended, with probably 20 to 25 participants at each. And from those meetings, working groups formed and are now actively exchanging resources and working together within the pillars of education and training and capacity building. And in fact, there are some pretty exciting new resources on the horizon within our community that will really start to identify, not just identify, but address gaps and barriers in our province. So what's evident to me in all of this is that people want to connect, right? Not just with one another, but also with employers, with businesses, with union representatives, researchers, policymakers. And our network is growing. But there's more work to do, and I'm here to help connect the dots. I'm also sorry I have a cough drop in my mouth because my throat is dry because I don't like being on stage. People want to connect. And this year I've had the privilege of meeting with leaders from across sectors, from nonprofits to government departments to businesses, universities, all to build bridges and have meaningful dialogue, creating full participation for persons with disabilities and disability service organizations. And many of our member organizations themselves are doing the same. So for example, in Pictou County, Summer Street Industries Participant Council has been meeting with the emergency department at the Aberdeen Hospital in New Glasgow. They're working together, having identified that the emergency department can be a stressful and traumatic experience for persons with disabilities. And they're working together to remove those barriers to receiving medical treatment, as well as educating nurses and support staff. The Health Authority in Pictou County is committed, invested in making the emergency room more accommodating, and Summer Street employees and participants are leading the way, developing those strategies with the hospital administration. That's pretty cool, right? At the municipal level, I've presented on behalf of the partnership to the Association of Municipal Administrators, or AMANS, and recently I was invited to attend their Equity and Anti-Racism Symposium in the Valley. These efforts are helping administrators connect with community organizations as they work on finalizing their accessibility plans this year, and connecting them with organizations and individuals so that they can truly center the lived experience while they are developing those plans. Institutions like Mount St. Vincent have also reached out when they needed help planning a panel and a World Cafe event on inclusion. The partnership was able to link them with members of our organization who brought lived expertise, innovative ideas, and inclusive practices to that table. And after each of those meetings, I made sure to leave people with the community resources they were looking for, the information to supplement their work moving forward. And I walked away with stacks of business cards, scheduled meetings, requests to join the partnership, and commitments to stay connected. Because people want to connect, right? So today I'm here as the coordinator of the Disability Partnership. I'm here as a woman with an invisible disability. And I'm inviting you to take a step forward toward full inclusion and participation by being vulnerable in your work today. It's evident that there's value in the Disability Partnership's approach. Some statistics, also not my favorite. But in January 2024, I set a goal to engage 20 unique organizations and successfully have them all join the partnership by December 31st of this year. Today's the 3rd, and the partnership has grown from 4 organizations to 31 organizations. That's big numbers. And again, not a big numbers girly, but that's 675% increase. That's massive. And I surpassed my own goal by 55%, which is really incredible. And we're still growing. We're so pleased now to be able to expand our membership into a 2-tiered program. Tier 1, which is who I've reached out to over the past year, is our voluntary membership. So that's free for nonprofit organizations in the voluntary sector. It's flexible and it's designed to really center and uplift people with disabilities as leaders in our communities, as future employees, as equal participants in services, and as advocates for social change, with the goal of ensuring that their rights are upheld and voices are heard. Members have opportunities to collaborate with one another, develop and share best practices, provide consultation and influence to the external entities, as well as receiving early access to events like this one. Tier 2, or our affiliate membership, is available for the rest of y'all. So the businesses, governments, prescribed public sector bodies. And that's available for an annual fee. And that will give you access to all of that lived experience, that first voice expertise, creating learning opportunities, professional development, giving you access to a network of skilled facilitators, speakers, and of course me, I'll be your dedicated point of contact. Because I know it's getting tedious, but remember what I said before? People want to connect. So let's do that. Let's do that today. I challenge you to connect with us today. Or me. Come and find me after I leave the podium. Scan the QR code and join the partnership. Make a statement about your commitment to equity and diversity and inclusion and accessibility in this province. Recognize the privilege that you hold and use it to be an advocate. Because at the end of the day, people want to connect, and I'm here to make that happen. Thank you.
Thank you, Amelia. Your wisdom and insight made me stop and reflect on my own interactions and the way that I'm able to show up, and we all should be making a commitment to show up. So thank you for prompting that. And no matter how much we all think we know, we're still learning.